The abdominal pain primarily, especially acute pancreatitis, is very severe and almost always leads to hospitalization. That's one, but other things that are kind of less specific, mental fog, confusion, memory impairment, depression, severe fatigue, those kind of symptoms could be FCS that's not really been diagnosed. And I think one of the challenges that these patients face is they go to multiple physicians before finally someone comes up with the correct diagnosis. Yes, there's another form of severe hypertriglyceridemia which isn't technically FCS, and it's usually due to secondary causes, diabetes, hypothyroidism, some other medical condition that may have an underlying some genetic component to it, but not the true kind of monogenic or heterozygous of multiple mutations that lead to the more severe FCS type of condition. The care team is really important because lipidologists can make the diagnosis and can deal with the triglyceride elevation with our regimens, but we're not pancreas experts. And so oftentimes there's complications that lead to either chronic pain with the pancreas, recurrent episodes of pancreatitis with inflammation, or even chronic pancreatitis, which needs another whole regimen of different therapies. And so I think working together in the team can make a huge difference. The other part of the team that's critical is the dietitian, because you really need to work on extremely low-fat diets and even low-carbohydrate diets with low-fat diets to maximize the ability for these patients to maintain a lower triglycerides and reduce the risk for pancreatitis. The most important thing is how low the fats have to be. It's not just saturated fats, all fats. And so sometimes people get in their mind, saturated fats are bad. I can have olive oil, I can have canola oil, I can have other types of fats, avocados, things like nuts, things that are considered healthy fats. In this case, that's not the case. They have to restrict total fat consumption, all fats, regardless whether it's saturated, unsaturated fats. Total fat has to be reduced. I think there's really 2 points. Once, if you can make the diagnosis correctly, there's a tremendous burden off the patient to know they have genetic disorder. They've been accused of being alcoholics, other causes of pancreatitis, and so for them it's a very frustrating to have experience and not having the diagnosis made correctly. That's issue number one. The second issue is how poor the quality of life is in general, even in between episodes of pancreatitis, which can be severe and debilitating and require hospitalization and can even be fatal. It's how terrible they feel even in between those episodes, fatigue, malaise, cognitive impairment. Those things make them really feel awful. It's also the social isolation, not being able to eat things that other people can eat and drink and have a good time with their friends and colleagues. That all creates a very difficult situation, and that's why having the social network available to help them better understand how to deal with the condition is very valuable.